Hello, 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 everybody. We're going to continue and finish up hypersensitivity and say a few words about autoimmunity. So far, we've discussed type 1 through type 3 hypersensitivities, which are all immediate and depend on some kind of antibody. The fourth type is a very delayed response, and there are no antibodies involved. Instead, we're going to depend on our T cells, the T helper cells in particular, initially. So in type 4 hypersensitivity, or also called delayed hypersensitivity, it can take days before a person sees a reaction. I mean, it can be within a day, but it can take a long time before there's actually a response. And again, so we do not have any antibodies involved. So typically what we see is that because a previously sensitized TH cell, therefore a TH memory cell, when it's exposed to an antigen on an antigen presenting cell, the TH cell is going to start secreting cytokines that then activate our macrophages to trigger inflammation. But they can also activate our TC cells such that they can release their granzymes and perform very similar to what natural killer cells do and create lysis of the cells. Once again, there are different forms of type 4 hypersensitivity. Let's take a look at them. There are actually many types of hypersensitivity 4. We're just going to take a look at a few, such as contact dermatitis, the tuberculosis test, and then granulomatous type hypersensitivity. So in contact dermatitis, we're dealing with something called a hapten. So the response is, or the reaction that, the hypersensitivity reaction, I should say, is due to the response to what is referred to as a half antigen or a hapten. So it's not really functional all by itself. It needs help from something else, and that's going to be uh, usually a protein. We call it a carrier that helps it out. Haptens on their own are lipid soluble, and remember, anything that's lipid soluble can very easily diffuse through the cell membrane. Therefore, if you rub against a poisonous plant, that hapten can very easily penetrate into your epidermis. And of course, that's where we have our Langerhans cells located, et cetera, et cetera. We'll look at the mechanism in more detail on a diagram. Haptens are rampant, particularly in various secondary plant compounds. We also see it's part of latex items, latex products. We're not talking now about the rubber protein. Latex products have all kinds of additional chemicals in them in addition to the rubber protein. Many cosmetics, on and on, some metals, ointments, they all have various kinds of haptens in them. So here we're looking at a diagram that first focuses on the left-hand side on the first exposure to the hapten. And by the way, they're just calling it an antigen here. Make sure that you realize that this is a hapten. All right, that's going to have to bind to some kind of a carrier like a protein before it can trigger an immune response. And so on this side, then we see the actual type 4 hypersensitivity with, for instance, our blisters or little blisters here due to the exposure to our poison ivy oils or secondary compounds in our plants. So hapten rubs against our skin. The hapten is lipid soluble, very easy to get in. It binds to some kind of a protein. And now a dendritic cell, of course, in the epidermis, that would be the Langerhans cell recognizes this as a foreign antigen. It processes it and then presents it to our T helper cell. And then our T helper cell is going to start eventually producing some memory T helper cells. So this is the sensitization process. And then when a person is re-exposed, within a few days, we're going to see that um, the hypersensitivity reaction occurs, because this time our memory T helper cells is going to activate with the help of cytokines macrophages to trigger inflammation, as well as our cytotoxic cells. Remember, they function very similarly as our natural killer cells, but despite the fact that they are part of the adaptive immune system. Remember that we discussed latex allergies in the type 1 hypersensitivity, and recall that that is very often an anaphylactic response, especially when a person has been exposed repetitively to the rubber protein in latex. So the rubber protein is going to be mostly responsible for the type 1 type of systemic anaphylactic response, or the non-atopy response. Type 4 latex allergy, also called the latex contact dermatitis, is much, much milder, and it's really mostly just restricted to the areas of contact, such as the hands and the legs, and not life-threatening, unlike type 1, which can be very life-threatening. So researchers have come up with a way to actually take advantage of a type 4 hypersensitivity response. And we do this, we force it to occur to some extent in order to test a person for a prior infection with the tuberculosis bacterium. So we call this the tuberculin type of hypersensitivity, or the MAN2 test for the person who developed the skin test. So literally, a person is given a very small amount of the tuberculosis antigen of our tuberculosis bacterium, very small amount to keep it all very controlled. But if the response is, a little blisters and redness in a very localized area, because it's such a small injection, that is therefore proof that the person was previously exposed to the pathogen that creates or causes tuberculosis. If there's no reaction, then the person was never exposed. So here we're again going to talk about tuberculosis, and we've brought up tuberculosis before when we learned about granulomas in our discussion of inflammation. Remember that granulomas might form. You see one right here with the epithelioid cells and the giant multinucleated cells, which are just really modified macrophages. We discussed them before in chronic inflammation. So this is essentially a form of a chronic inflammation that is also a type 4 hypersensitivity. This is now mediated again by macrophages and also lymphocytes. And what's interesting is that desensitization does not work. We can desensitize most of the other hypersensitivities by treating people in various ways, but that is not possible in this case. So the problem here, or what makes this a chronic form of hypersensitivity, what creates the granulomas, is that literally the antigens are not, they cannot be digested by means of phagocytosis. And therefore, we're going to see that they persist and they get isolated inside of these granulomas, which can protrude, as we've seen in the lungs, to form even the tubercules. From there the name tuberculosis. Other types, oh, and by the way, leprosy is another very good example um, that cannot be digested very easily. So both tuberculosis and leprosy are caused by the bacterium Mycobacterium. I'm sure you remember that. Now, there are other things that cannot easily be digested by our phagocytes, and those are such things as talc and silica, some of the surgical sutures, and there are many more examples. Asbestos can be listed here as well. So this wraps up our discussion of type 4 hypersensitivity. We've only looked at 3 of these. You need to scratch out this one. I accidentally left this one in, but we have not discussed this one. So please, you're not responsible for that one. Again, there are many more kinds of type 4 hypersensitivity. And so we finally finished discussing type 1, type 2, type 3, and type 4 hypersensitivities, with the last one being a delayed type of hypersensitivity, which can take days, if not weeks, to occur. And here you see a nice diagram giving you an overview of the 4 types of hypersensitivities. I want to note that for type 2 here, that we do not have listed the third form of type 2 where we discussed myasthenia gravis, for instance. And here you have some nice tables comparing the 4 hypersensitivities to help you study all of this material better. And that leads us into autoimmunity. So in autoimmunity, very different from hypersensitivity, we see that antibodies cannot distinguish between self and non-self anymore. Literally, our immune system is failing ourselves. Often this is due to genetics, but we were thinking, based on research, that the environment can trigger autoimmunity as well. So remember, during our discussions of the different hypersensitivities, I listed and explained examples of autoimmune disorders, anywhere from rheumatic fever to myasthenia gravis to lupus. Um, so the overlap between hypersensitivity and autoimmunity lies in the fact that the mechanisms are the same that are happening, whether it's a hypersensitivity disorder or an autoimmune disorder, except that in an autoimmune disorder, the antibodies that are being built are against our own cells or antigens on our own cells. So we build autoantibodies. Um, Often this is due to a genetic condition, or it is thought that the environment can trigger various autoimmune diseases as well. Autoimmune diseases in general are very poorly understood, which is also why it can be difficult to treat them. So our discussion on autoimmunity is going to be very brief because during our discussions of the different hypersensitivities, we have touched on a few examples of autoimmune diseases. So be sure you know those examples and be sure you know what mechanisms they use. Again, the big difference is that in autoimmune disorders, we're not just talking about any antibodies, we're talking about antibodies called autoantibodies built against our own antigens. So in the next few slides, we're just going to look at some important um, aspects about um, autoimmunity, and we'll get started here with immune tolerance. You've already studied this when you learned about the adaptive immune system. Basically, as a quick refresher, what needs to happen as our B cells develop in the red bone marrow, as our T cells develop in the thymus, is that these lymphocytes better not be responsive to self-antigens. So we want them to be unresponsive to self-antigens. Yet we want them to be responsive to foreign antigens, right? Um, and if they malfunction in either situation, we're going to see that they are going to be dying by means of apoptosis. Now, it is possible that this so-called clonal deletion that leads to immune tolerance is not quite perfect. Let's take a look at this. So there are two levels of the process for immune tolerance. The first process occurs in your primary lymphoid organs, and recall for the B cells, where is that again? That is in the red bone marrow, right? While for the T cells, that is going to be in the thymus. So what needs to happen, if we look at our silly little diagram here, if this is our primary lymphoid organ, one of these two, right? And here we have a bunch of either T cells or B cells, depending on which lymphoid organ we are in. They haven't been tested yet. They haven't gone through the process of clonal deletion yet. But now we're going to, let's say, expose this whole set of either B cells or T cells to self-antigens, and notice that they all failed. That means they all are going to go through the process of apoptosis. So this is a full-blown, complete clonal deletion. Here, on the other hand, we see that only some cells are going through apoptosis, yet these cells also failed the test. So this is a form of incomplete clonal deletion. In other words, we're allowing some cells to sneak through that and enter the periphery, meaning they are allowed to leave the primary lymphoid organs, despite the fact that they could not distinguish self from non-self. And so this is what we call central tolerance. Now, these guys that sneak out are going to go through a second test in the peripheral environment, meaning in the secondary lymphoid organs, your lymph nodes, for instance, the spleen, for instance, the Peyer's patches, and so on. And if once again they survive, like these guys do, then we're having a problem with autoimmunity. Of course, there are endless examples of autoimmune diseases. I have listed here all the ones that we have already discussed. Let me check them off in the hypersensitivities, and the ones that we will discuss. So these are going to be in the future, in future topics. So keep an eye out for them. We'll discuss them in some of our blood disorders such as pernicious anemia, in arthritis, when we look at disorders of the central nervous system, and so on. There's many, many autoimmune diseases. Now, there are clear risk factors associated with autoimmunity. And what's quite interesting is that the majority of patients who have an autoimmune disorder are going to be female. Notice more than 3/4 of patients with an autoimmune disease are female. And even though we don't have full evidence, as you can imagine, that does imply it might have something to do with the kinds of hormones that we produce in higher quantities than a male. But in addition to that, research seems to suggest that when a person is repetitively or chronically infected with specific pathogens, they might develop an autoimmune disorder like EBV, or the Epstein-Barr virus, and Helicobacter pylori, which we now know is very much responsible for stomach ulcers. Back in the days, everybody always thought it was due to high acidity levels and eating acidic foods or whatever it was we thought. Now we know that it's primarily due to that particular bacterium. Stress can also trigger autoimmune diseases. Some medications, some that regulate blood pressure, for instance, it can run in the family. Or also, if a person already has an autoimmune disease. For instance, I have a friend who has had diabetes mellitus since he was a little boy, and he just recently also developed multiple sclerosis. As you can imagine, that's devastating to a person who's already been battling an autoimmune disease their whole life. Being overweight, and of course, by now you know that smoking is never ever a good thing for our body. Smoking does so many damaging things to our body. Now, if we had more time, we'd also discuss the various theories that explain autoimmunity. Um, Unfortunately, we just don't have the amount of time to cover these in any great detail. So what I've done for you is I have listed their names. For those of you who might be interested in reading up on those, perhaps some of you suffer from an autoimmune disease, maybe one of your parents, your brother, sister. So take a look at what these theories explain, or how they explain the development of an autoimmune disease. Um, these are very easy for you to understand, so you might be very interested in reading up on these. I will not hold you accountable for those for tests, either quizzes or exams. This is just for your information. So we are now done with hypersensitivity and autoimmune disorders. We still have to discuss one more group of immune disorders, and those are immunodeficiencies. And we will discuss a few of them in less detail than we will discuss AIDS. That will be our primary focus.